Recently, Chris Combs, who also stars in the show 1,000 Pound Sisters, received approval for skin removal surgery. However, it is possible that he will come to regret the decision. In the year 2020, Chris, who was 44 years old at the time, made his debut on television alongside the well-liked and scripted series. The experiences of sisters Tammy and Amy Slatton as they attempt to lose weight are the primary focus of the show. However, numerous of their other siblings, including Chris, also play significant roles in the show. Chris weighed more than 450 pounds when he first began his effort to lose weight through weight reduction. Chris was encouraged to pursue his own health and fitness ambitions after observing his renowned sisters as they worked toward their goals. There have been highs and lows along the way, and the road has not been an easy one. Due to the fact that he underwent bariatric surgery, he was able to shed a considerable amount of weight, which resulted in him having a great deal of loose, superfluous skin. Read on to find out what the star of the 6th season of Sisters, who weighs 1,000 pounds, intends to do about all of the excess skin. Chris underwent weight loss surgery. During the year 2022, Chris underwent bariatric surgery, which resulted in him losing 150 pounds. At his most recent weigh-in, he weighed 300 pounds. A remarkable before and after picture of Chris was shared on Instagram by his physician, Dr. Eric Smith, in the month of March. On one side is a picture of Chris before he started losing weight, and on the other side is a picture of Chris finishing a 5K run that was taken not too long ago. Himself, the 6th season of Sisters, Chris walked on a scale to weigh himself at 1,000 pounds, and he was heartbroken to discover that he had reached a plateau in his weight loss. What caused Chris to reach a weight loss plateau? At the time of the 6th season of 1,000 Pound Sisters, Chris weighed 299 pounds, which meant that he had only lost 1 pound since his previous weigh-in. Since Chris began his mission to lose weight, he has accomplished an astonishing 150 pounds of weight loss, despite the fact that he is saddened by the setback. Chris, along with several of his other siblings, is so eager to get rid of all the excess skin that has been left behind as a result of his quick weight reduction that he was disappointed when his doctor told him that he needed Chris to drop another 60 pounds before he could proceed with the procedure. Chris managed to get back on track despite the fact that he had reached a plateau. Chris went to see a plastic surgeon in a later episode of the 6th season of 1,000 Pound Sisters. The plastic surgeon agreed to perform the procedure on Chris if he shed an additional 20 pounds. Despite the fact that Chris is very enthusiastic about skin removal surgery, it is a technique that is both painful and expensive, and it does not come with any assurances. The name, Combs, Chris. Happy birthday. I was 44 years old on October 29, 1980. Relationship status. Brittany Combs is the married woman. Gains in weight, 175 kilograms. Chris Combs, a prominent figure from the reality TV show 1,000 Pound Sisters, has undergone an inspiring and challenging journey toward weight loss, accompanied by emotional, physical, and psychological hurdles. Alongside his dramatic transformation, the issue of skin removal surgery has become a focal point of conversation within the weight loss community. After significant weight loss, many individuals face the dilemma of excess skin, which can often present both a cosmetic and medical challenge. While skin removal surgery can offer a solution, it also carries risks that individuals like Chris Combs might later regret. This essay delves into Chris's weight loss journey, the emotional and physical tolls of his transformation, and the potential consequences of opting for skin removal surgery. Chris Combs' journey to weight loss, background and struggles with obesity. Chris Combs, like his sister Amy, was once severely obese. On the brink of potentially life-threatening health complications, Chris' weight had ballooned to an astonishing 600 pounds. In the reality show 1,000 Pound Sisters, viewers witnessed his battle with weight loss, which involved confronting deeply embedded issues surrounding food addiction, emotional eating, and a lack of self-discipline. In the first season of 1,000 Pound Sisters, Chris' health was in jeopardy. His struggle to find a solution was compounded by family dynamics, with his sister Amy going through a similar journey of weight loss. Their shared experiences offered a level of camaraderie that was essential in maintaining motivation. However, it was clear that the road to recovery would not be an easy one. The turning point, surgery and weight loss milestones. Chris's turning point came when he recognized the necessity of bariatric surgery to kickstart his weight loss. With a weight loss goal that required discipline, perseverance, and a long-term commitment, Chris began following a medically supervised weight loss program that focused on both lifestyle changes and surgical intervention. Bariatric surgery, which typically involves procedures like gastric bypass or sleeve gastrectomy, helps individuals lose weight by limiting the amount of food they can eat or reducing the absorption of nutrients. It wasn't an instant fix for Chris. The surgery helped curb his appetite and led to a significant weight reduction, but it also required continuous support, a balanced diet, and consistent exercise. Over time, Chris began losing pounds rapidly, resulting in a dramatic change in his appearance. He shed hundreds of pounds, but with this success came a new challenge: his body's excess skin. This issue is common among people who lose a considerable amount of weight in a short period. Excess skin after weight loss, a common challenge. The physical and emotional impact of excess skin. While Chris' success story is undoubtedly inspiring, it also reflects a common reality faced by many individuals who undergo substantial weight loss: excess skin. When the body loses a large amount of weight, especially in a short time frame, the skin can become loose and sag. This is due to the skin's ability to stretch and expand over time to accommodate the larger body size. However, after losing significant weight, the skin's elasticity may not be sufficient to snap back into place, leading to a sagging appearance. The impact of excess skin can be profound. On the physical side, it may lead to discomfort, chafing, and difficulty with movement. For someone like Chris, who has been working hard to regain his mobility, excess skin can impede his ability to exercise and fully enjoy a new, active lifestyle. In some cases, excess skin can cause rashes, infections, or even back and joint pain due to the added weight of the skin. The emotional toll is just as significant. Although weight loss might bring an individual closer to their goal of looking and feeling better, the sight of excess skin can be a stark reminder of the weight they once carried. It can impact self-esteem and body image, making individuals feel as though they haven't fully achieved their goals, despite their hard work. Skin removal surgery, the potential solution. What is skin removal surgery? Skin removal surgery, also known as body contouring, is a common procedure for individuals who have lost a significant amount of weight and are left with sagging skin. The surgery typically involves the removal of excess skin and the tightening of remaining tissues to create a more toned and contoured appearance. This can be done in various areas of the body, including the abdomen, thighs, arms, and chest. For Chris Combs, who has lost a substantial amount of weight, skin removal surgery may seem like the natural next step. It promises to help him achieve a more desirable appearance by eliminating the sagging skin that is often associated with dramatic weight loss. Body contouring can also help reduce some of the discomfort and health complications that come with excess skin. The benefits of skin removal surgery. The primary benefit of skin removal surgery is cosmetic. Many people who have undergone extreme weight loss find that removing excess skin boosts their self-esteem and allows them to enjoy their new body more fully. The procedure can also improve functionality, enabling individuals to move more freely, engage in physical activities without hindrance, and avoid skin-related medical issues like rashes or infections. For Chris, the ability to fully embrace his new lifestyle may depend on whether he chooses to undergo skin removal surgery. His commitment to health and fitness could be further supported by a more toned and less restrictive body. The risks of skin removal surgery. Could Chris regret it? Potential complications and side effects. While skin removal surgery can offer many benefits, it is not without risks. One of the major concerns is the potential for complications during or after the procedure. As with any surgery, there are inherent risks involved, such as infection, bleeding, and adverse reactions to anesthesia. Furthermore, the healing process can be lengthy and painful. After surgery, individuals typically experience swelling, bruising, and discomfort that can last for weeks or even months. Chris Combs would need to consider these risks carefully, particularly given his history with health complications. Although he has made significant progress with his weight loss, his body may still be vulnerable to issues that could complicate the healing process. Another potential complication is scarring. Skin removal surgery often leaves permanent scars, especially in areas like the abdomen or thighs, which may be difficult to conceal. While some individuals are willing to accept these scars in exchange for a more toned body, others may find them distressing, especially if they were hoping for a more seamless transformation. Psychological effects of surgery. The psychological impact of skin removal surgery is also a critical factor that Chris must consider. For many individuals, the decision to undergo surgery is a deeply emotional one, as it can represent a final step toward achieving their ideal body image. However, there is also the possibility that the surgery may not result in the complete transformation that the individual hopes for. This can lead to disappointment, frustration, or even feelings of regret. Chris has already demonstrated a commitment to his health and weight loss, but the emotional toll of skin removal surgery could be significant. He may feel conflicted about whether the surgery is truly necessary, especially considering the potential for dissatisfaction with the results. The long-term impact of skin removal surgery. The need for ongoing maintenance. Even after undergoing skin removal surgery, individuals like Chris Combs would need to continue their efforts to maintain their weight loss. The surgery is not a quick fix, but rather a complement to an ongoing lifestyle of healthy eating and exercise. If Chris were to regain weight after surgery, the excess skin could return or worsen, negating the benefits of the procedure. Additionally, maintaining the results of the surgery requires consistent care, including avoiding extreme fluctuations in weight and adhering to a healthy diet. For someone who has already faced numerous challenges on their weight loss journey, the prospect of maintaining results after skin removal surgery could feel overwhelming. Chris may find it difficult to balance the demands of recovery with the need to stay active and healthy long-term. Should Chris Combs undergo skin removal surgery? The decision to undergo skin removal surgery is deeply personal, and it is one that Chris Combs must make after weighing the potential benefits and risks. For individuals like Chris, who have undergone remarkable weight loss, the emotional and physical toll of excess skin is undeniable. Skin removal surgery may offer an opportunity for a more satisfying aesthetic outcome and greater functionality, but it is not without its drawbacks. Chris has come a long way on his journey to health and well-being, and the decision to undergo surgery should be made with careful consideration of both the immediate and long-term consequences. Whether or not he regrets the decision in the future will depend on his expectations, the results of the surgery, and his ability to maintain a healthy lifestyle after the procedure. Ultimately, Chris's weight loss story is a testament to the resilience of the human spirit and the power of commitment and perseverance. Regardless of whether he chooses to undergo skin removal surgery, his journey has already inspired countless others to take control of their health and pursue their own transformative journeys. Chris Combs' incredible weight loss milestone is a testament to his determination and hard work. As he continues to navigate the challenges of excess skin, the decision to undergo skin removal surgery is a significant one, fraught with both potential benefits and risks. It is important for Chris to carefully consider his options and to approach the decision with a full understanding of the potential consequences. Whether he chooses to proceed with the surgery or opts for an alternative solution, his journey serves as an inspiration for others who are embarking on their own paths to better health. Ultimately, Chris Combs has shown that the road to transformation is not just about shedding pounds, but also about embracing the emotional and physical challenges that come with it. His story is a reminder that in the pursuit of a healthier and happier life, there are no shortcuts, only determination, resilience, and the courage to make difficult choices.